Hey guys, it's Ben, and I'm sitting here with Dr. Baruch Kim, who's the Chief Resident at Rusk Rehab.
Hey guys, Baruch Kim here. It's an honor to be sitting here. Today we're going to talk about the specialty, Physiatry, and also the life of being a physiatrist. You guys ready? Vamos.
Let's go. Let's get started. So, Dr. Kim, can you give me a brief explanation about what physical medicine and rehabilitation is?
Physical medicine and rehabilitation, also known as PMR, aka Physiatry. The definition of Physiatry is restoration of function. Simply put, it's about helping a patient get back on his or her feet.
Okay, so restoring function is the essence of it. Can you give me an example of when you had to restore function for a patient?
I'll give you a very simple, brief example. So let's say you have a patient that comes into your office with an ankle injury. You're kind of like the primary care physician in musculoskeletal medicine, and you do everything for that person. Assessment, you form all of the treatment plans for that person. Also, a big portion of being a physiatrist is about being a diagnostician.
That's a lot that you have to do being a physiatrist. How big is the scope of Physiatry really?
It is a little bit challenging to pinpoint exactly what we do because we do a lot of things. We treat patients with musculoskeletal injuries, neurological disorders such as Guillain-Barré, multiple sclerosis, spinal cord injury, cerebrovascular accident, also known as stroke, traumatic brain injury. We provide treatment options for cardiopulmonary rehab. There are many things that we do. What's so great about it is that you get to choose what you want to do, or you could just do everything, literally. Fellowship-wise, there's pain medicine, there's spinal cord injury, traumatic brain injury, and also there's pediatric rehab. Cancer rehab is big.
So there's a lot of fellowships available after you complete your PM&R residency.
Yes.
When did you decide that doing a PM&R residency was right for you? Did you have a certain experience that led you to this decision?
Yes. Prior to entering medical school, and I worked as a licensed physical therapist assistant for 5 years. And every single day I went to work, it was very meaningful. I wanted to be the leader of the interdisciplinary team comprised of physical therapy, occupational therapy, recreational therapy, art therapy, social worker, case manager, and also nursing. So you're right in the center of this interdisciplinary team, and you come up with the best treatment plans for your patient. It's very meaningful and also rewarding. I would say PM&R is passion, meaningfulness, and also rewarding.
It sounds like it.
I just came up with it.
So in essence, you're the leader of this entire team that takes care of the patient.
Pretty much, you are the leader of the team. Oftentimes what we have is identity crisis. What do we do? Because we do literally everything. When you're on inpatient service, and you're the primary care physician taking care of labs, vitals, and any other things that may impede one's ability to restore their function.
So it sounds like you have a lot of other specialties also combined, kind of like neurology, internal medicine, rheumatology, even orthopedics. All of this can be incorporated in this one specialty. What is a resident's life like in PM&R?
We do spend quite a bit of time in the hospital taking care of the sick patients. These patients are sometimes the sickest patients in the hospital. However, after work hours, most people do pretty much the same things that other people do. We go out and we go to dinner, and there are a lot of things that we do to keep ourselves pretty much healthy, psychologically and also physically.
So you say the work-life balance is pretty balanced in a PM&R residency?
So I would say work, life, equal.
It's equal.
I don't count the number of hours. I let the number of hours count.
That's a great motto to go by.
You're never bored. You're never ever bored. That I guarantee. You may go to work early in the morning, however, you let the number of hours count.
Good. Do you have any questions for me?
What are the factors that made you want to pursue career in physiatry?
One of the most important experiences that I've had, I had a patient. What happened was this man, he was about in his 40s, mid-40s. He fell off his bicycle and suffered multiple fractures in his spine, in his thoracic and lumbar vertebrae. When he was done with surgery, he was transferred over to the rehab floor where he couldn't feel or move his legs. In the course of about 2 weeks of working with him, he was able to walk again, and it was probably one of the most amazing experiences that I've had in medicine, and that really reinforced my my wanting to go into physiatry. Well, I think that I want to see what a physiatrist does every day and how to do a full neurological exam, and I don't think there's anyone better to show me than the chief resident from Rusk Rehab.
We are the musculoskeletal experts. Can you cut this out? I'm ready. I'm going to show you how to do a simple physical exam. Proper examination is key to success. It's everything, literally, absolutely everything. You could eliminate a lot of unnecessary tests, which could be quite costly, and you could save the patients a lot of money by providing a good physical examination. That's why I talked about the term diagnostician. We are the true diagnostician in musculoskeletal medicine. I'm ready. Are you ready?
Let's get started.
Let's go. Let's go from top to the bottom. That'd be okay?
Yes.
All right, very nice. Let's talk about range of motion briefly. There's active range of motion. We have active assisted range of motion, and then we have passive range of motion. Let's start with the right. Now we're doing the shoulder examination, okay? What's really important is that you're testing for the motions in the shoulder, not in the elbow, not in the hand, not in the wrist, okay? The best thing to do is showing them what you expect them to do. It's like a great thing. You demonstrate for that person, so to make things easier. The other thing is you do this because you want to make sure that the patient is well balanced. You don't want the patient to fall over. As the patient is doing this, you want to stand right next to the patient, making sure the patient does not fall, suffer from unexpected injury. Right? So bring your chin up, all the way back. Very good range of motion so far. I like this. Hip flexion. Well, if your muscle is being shortened, so right now the hip flexor is over here, iliopsoas. So the psoas major, meet with the iliacus to form iliopsoas in the muscle attached to the lesser trochanter. While you keep your knee straight, can you bring your parallel leg up? And you don't have to impress me this time because your motion will be very limited because there are 3 ligaments that are limiting the motion. I'm expecting very limited range of motion. Do it right? You did it right. Perfect.
Hey guys, if you like this content, make sure to subscribe below and give us a like. We'll be putting out a lot more educational content. Thank you guys for watching this video. Like, subscribe, comment. Have a great day. We'll see you in the next video. See you later.